A lot of us desire plumper and fuller lips. How can we achieve that? Watch this video to find out. Hi, I'm Dr. Shreya Krishna, your trusted oral and maxillofacial surgeon from New Delhi. Fuller lips, thick lips एक attractive feature माना जाता है, especially for women. Even though fuller lips and plump lips are characteristic of Indians, a lot of Indians from east part of the country do have thin lips, and they often want accentuation of those lips in order to look more attractive. तो हमारे पास क्या-क्या options हैं and what is the safest way to execute this? So everything begins with an examination, and of course the experts to do this are oral and maxillofacial surgeons who combine the knowledge of your skeletal structure with the structure of your facial skin and your soft tissues. So बहुत simplify करके मैं आपको बताती हूँ कि to make your lips plumper, there are two ways to go about it. The first is surgical options, which are the permanent options, and non-surgical options, which they're quick, they're effective, but they are not permanent. They are just temporary. So first I'll tell you that when we look at you and we analyze you, how do we decide which option to go for, and amongst these options, how do we understand which would be the best for you? So the first thing that we see is the thickness of your vermilion to your white roll. So this is your white roll and this is your vermilion. So what is the thickness of that? We see that. Second, we see the length of the entire upper lip, which is from the base of the nose till the tip of the vermilion. And then we see what is your support for your upper lip. How are the teeth positioned? How is the maxillary bone beneath the lips positioned? Are they adequate or are they also deficient? A lot of times just plumping up the lips would not be enough. A lot of times we have to maybe plump up this area of the face, or maybe we need to do something to the teeth in order to make your lips look fuller. So that is another thing we have to consider. And now moving on to how do we decide which option to go for. So in your surgical options, you have a couple of options to make your lips thicker. The first is lip lift surgery. This is a permanent way to make your lips plumper, and in this surgery we are overall making the entire lip from here corner to corner. The entire lip becomes thicker. Along with becoming thicker and plumper, there are two other changes that happen to it. The first is that more of your vermilion, which is your pink part of the lip, starts showing, and second is there is an eversion of the lip. With the eversion of the lip, there is this kind of upliftment. So this upliftment and eversion of the lips also leads to increased show of your teeth beneath your lips. The advantages is this is permanent, it is very, very effective, and it is very uniform. Uniformly the entire lip becomes thicker. The disadvantages, there is a small scar visible here in this area. However, this scar becomes less and less visible as months go by. After a year, maybe you hardly get to see that scar. And the second disadvantage is for people already with a gummy smile, this might accentuate that. The other surgical option we have is a VY-plasty. So in the VY-plasty, only the central portion of the lip becomes thicker and more pouted. The advantage is the cut is absolutely from within. There is no scar on the outside. The other advantage is, again, it's permanent. The disadvantage is it only corrects the middle portion thickness, and it is not for the entire lip. And second, again, it might lead to over lengthening of the lip. So basically for somebody with a normal lip length or a excessive lip length, this might lengthen it further. Now going on to the non-surgical options, there are two. The first is doing fillers, which is very, very common. In fact, among celebrities, usage of fillers has increased tremendously. Lip fillers is a very good option. In fact, I in my practice consider it to be a precursor to a permanent lip plumping or lip enhancing procedure, because it lasts for about 9 to 12 months, the plumpness, and it gives you a good idea. If you like that look, you can go in for the permanent option. The second option, which is slightly more permanent but very unpredictable in its results, is fat grafting of the lip. Now, even though it is a very good alternative to the permanent surgical methods, however, the unreliability of the fat dissolving in the body makes this procedure slightly unreliable overall for a feature that is as prominent as the lip. If you are somebody who has thin lips and is looking for fuller lips, please drop in a comment, like, subscribe to our channel and ask us more. Thank you.